All right. So next, again, I apologize for this kind of again very arbitrary graph on here, but have your Wiggers diagram in front of you as I'm discussing this, and also don't forget to be using your interactive physiology CD or the exact same version that's on the MyAMP website to help you study this, and also to follow along while I'm talking about this. Okay. So again, have the Wiggers diagram out in front of you, and and again, make sure you're using, have the textbook open and have that interactive physiology site is open in front of you as well. And use it as a study tool after hearing this discussion, because it'll go step by step by step through this. Okay, so I'm explaining this based on Merriam's anatomy and physiology textbook. Okay, I know there are many other ways to discuss the cardiac cycle, but that's the way I'm doing it for my class, because that's the book we use. So now remember, before listening to this lecture, make sure you go back and listen to the little talk I gave on pressure and volume and the inverse relationship that they have with one another, because that will make this a lot more understandable as well. So if you haven't listened to that yet, please go back and listen to that and then come back to this one. Okay. So now basically, when we take a look at this, when you have the Wiggers diagram in front of you, what it is just a way of showing you pressure and volume changes within the heart as the heart is beating. Okay, and what the cardiac cycle itself is that the Wiggers diagram is representing, basically is all the events that occur during one heartbeat. Okay, all of the events that occur during one heartbeat itself. Okay, so now if we kind of look at the top portion and then on the kind of like the clutter version, the clutter part up here, you can see lots of up and downward spiking going on. Now the upper portion of this is representing pressures. Okay, so this green line is representing ventricular pressure. This white line is representing atrial pressure, and then this red line you see on top is representing aortic pressure. Okay, and then when you take a look at the bottom and in this middle representation here, this is ventricular volume. Okay, and we're kind of having our focus, as most Wiggers diagrams tend to do, on the left side of the heart, so the left atrium, the left ventricle, and so on. Okay, and then on the bottom here you have the EKG, so you can see exactly what's going on in the EKG while the heart is beating itself. Okay, so what's going to happen first, now again, you have to keep the concept in your mind that all four chambers do not simultaneously contract. There is a very brief period where they simultaneously relax, but they don't all contract at the same time. All right. Now, the first part, again, according to your book, the first part of the cardiac cycle is ventricular filling, basically blood getting down into the ventricles. Okay. Now, bear in mind that when we take a look at the heart, it's an organ that's made up of chambers. Okay. And these chambers, all right, there are two on top and there are two on the bottom. All right, now we're starting this again with blood up in the atria. All right, and again, I apologize for this kind of horrid drawing here, but this is where it's kind of got to go with it. Now, basically, 80% of ventricular filling, we would say, is passive. Okay, now remember that the atria are upper chambers. They're chambers that are on top of the heart. So once we build up a high enough volume of blood within the atria, that's gonna create enough force to open the AV valves, the tricuspid and the mitral valves. Okay, so then once we open those valves, gravity just does most of the work for us. That blood is just gonna fall right down into the ventricles. Okay, that's why we say that 80% of ventricular filling is passive, and that's why someone with atrial fibrillation can still live a manageable life. Is because even though the atria are radically contracting, all right, we don't really need to rely on much of the pumping action of the atria to get blood into the ventricles. Okay, so 80% of the ventricular filling is passive. The remaining 20% is active. Okay, meaning the atria are actually going to contract, and that's when you see the P wave on the EKG. Okay. That's the P wave, and that's when you see this brief rise in pressure within the atrium itself. Okay, so basically what's happening here is the atria are contracting, and then they're kicking the rest of that blood, that remaining 20%, down into the ventricles. That's what they call it. They call it atrial kick. Okay, now atrial kick is really neat because they like to describe it as a primer for ventricular systole, for the ventricles to contract. So as we forcefully move that remaining 20% of blood down into the ventricles, that's going to make the walls stretch with a little more force, and that's going to aid in the pumping action of the ventricles itself. Okay, so now once we empty out the atria and the ventricles are full, then according to your book, we begin the next phase, ventricular systole. Okay, now remember, think of systole as pumping, diastole as relaxation and refilling. Okay, so during ventricular systole, there are two parts to this as well. The first part of ventricular systole is called isovolumetric contraction. Isovolumetric contraction. Okay, so what we're saying here is that think of iso as the same. So what's happening here is the ventricles are contracting, but the volume is not changing. Okay, the volume is not changing. So what's happening here is that the pressure is starting to rise. The pressure is going up because remember the volume and pressure discussion that we just talked about. As volume goes down, pressure goes up. Okay, so that's what you're seeing here is you're seeing a rise in ventricular pressure, but there isn't enough yet to open the valves. Okay, I should say to open the semilunar valves. Okay, in this situation, the aortic valve. So what's going to happen is there's a very brief moment in time when all four valves are closed. Okay, when all four valves are closed at the same time, and it's only a tenth of a second, 10th to 15th of a second, not much. Okay, but all four chambers are simultaneously closed. Okay, and then as we start to and that's when you're looking at the QRS complex. Okay, and now all of a sudden we start to see the ST segment on here, and you'll notice the pressure rises even higher. Excuse me. And the pressure is rising even higher during the ST segment because now the ventricles are getting smaller and smaller. And then what you'll notice here is that eventually we'll get to a high enough pressure to open the aortic valve. Okay, we'll get to a high enough pressure to open the aortic valve, and then that's why you see the pressure rise in the aorta because because vessels are a little different when it comes to pressure. As we fill the vessels with more blood, their pressure rises because by definition, blood pressure is the force that blood exerts on the wall of a vessel. So as we have a higher volume of blood inside of a vessel, it's going to put more pressure and force on the walls of that vessel. Okay, so that's why aortic pressure rises as its volume rises as well. Okay, when I gave that talk earlier, the inverse ordeal about pressure and volume, just think of that in context of just the chambers of the heart. Okay. Then, at the same time, as you're seeing the pressure rise within the left ventricle, you're starting to see the volume significantly drop. Okay, you're seeing the volume significantly drop. And again, that should make sense because the chambers are getting smaller, just like you're squeezing a tube of toothpaste. As you grab that tube of toothpaste and you squeeze it, okay, you're applying pressure to that tube and you're forcing the toothpaste out. Okay, you're forcing the toothpaste out. All right, and that's when the volume drops. Now, when we take a look at this, basically there is a volume called N.EDV, which stands for end diastolic volume. So what we're saying here is how much blood is in the ventricles once we get to the end of filling. Okay, and it's typically about 120 milliliters of blood, 120 mils. All right, and then what's going to happen is the ventricles are going to go into the ejection phase of ventricular systole, and the aortic valve is going to be forced open, and then blood will be ejected out. Okay, and then we're going to reach another volume at the bottom of this called end systolic volume. Okay, what we're saying here is how much blood is left in the heart, in the ventricles after they squeeze, because the ventricles don't at rest, don't squeeze out, even at exercise, at full-blown exercise, don't squeeze out 100% of the blood. There's always a little bit of blood remaining in the ventricles. Okay, and we could say, give or take, that's about end systolic volume on average is about 50 milliliters. Okay, and if we take the two and subtract them, if I take 120 and 50, That'll give us 70 milliliters. That's what we call stroke volume. Okay, stroke volume. Stroke volume is the volume of blood pumped out of the ventricles per beat. Okay, per beat. All right, and that comes out to about, give or take, maybe, I don't know, 55% of the blood in the 55% in the of blood in the ventricles has been ejected out, and that's what we call ejection fraction. Okay, just the percentage of blood that's been ejected out of the ventricles. Okay. And again, that's the ST segment on the EKG. And then what's going to happen is on the T wave itself, what you're going to see is you're going to start seeing the pressure drop. You're going to start seeing the aortic, the pressure in the aorta start to drop, and then the volume is going to start to go back up a little bit in the ventricle itself. Okay, well, not quite yet. What we're seeing here is ventricular repolarization. So the ventricles have squeezed; they've pumped the blood out, and now what's happening is the heart is, the cardiac muscle, especially in the ventricles, is repolarized. So then what you're seeing is this big downward spike in pressure. Okay, it's big downward spike in pressure. All right, now this is what we call isovolumetric relaxation. Okay, basically what's happening here is all 4 chambers are simultaneously relaxed. All 4 chambers are simultaneously relaxed. All right, now all 4 valves are also closed. Okay, because as that blood it fills the aorta and the pulmonary trunk. Okay, once the ventricles relax and they relieve the pressure, okay, that volume of blood in the chambers is going to naturally want to flow backwards, back down. But remember, when we looked in class, you saw that those cusps of those valves, of those semilunar valves, are kind of cupped upward a little bit, and then there's about 3 of them. So then what happens as that blood starts to pool in those cusps of those semilunar valves, that slams them shut, and then the semilunar valves close, and then the atrioventricular, the AV valves are already closed because of the pressure in ventricular systole. Okay. So that's basically what's going on here with the cardiac cycle, is that you see the ventricular filling when 80% passive, 20% active, just blood falling and being ejected down into the ventricles, and then you will see ventricular systole. You'll see a rise in pressure, but there isn't enough pressure yet to open the semilunar valve. Now, at the same time, though, during this first part of ventricular systole, this is what's going to make the AV valves close, the mitral valve and the tricuspid valve. Okay. Now, when these valves close, that's when you hear the first heart sound, the lub. Okay. And then what'll happen is during this isovolumetric contraction, you'll eventually generate enough pressure, because the ventricles are squeezing more and more and more. You'll generate enough pressure to open the semilunar valves and now eject blood out of the heart, and that's why you see the volume significantly drop. Okay, and then the pressure in the aorta rise. Okay, and then eventually, once the ventricles start to repolarize and start to relax, then you'll see the pressure drop in both the aorta and the ventricles, and then you'll start to see the atrial pressure go up a little bit, because now the atria are refilling with blood. Okay, and then that will force the semilunar valves to close, and that's when you hear the second heart sound, the dub. So lub, dub, lub, dub. Okay, the heart sounds are the valves closing. All right, and then this is all going to start over again. Okay, and that's, again, in a nutshell, the cardiac cycle. Again, I would strongly recommend, not just reading through your chapter, but using that physiology CD to help make this understandable, and have that Wigger's diagram in front of you when you're looking at this. Because, like I said, all you're looking at are just volume and pressure changes within the heart. Okay.